Hello, everyone. Welcome to today's webinar, Supporting the MG Community with Financial Assistance Programs. I'm Jenna Mvalo, and I work with the MGFA. Before we get started, I'd like to thank our sponsors for making today's webinar possible. Thank you, Alexion, Amgen, Regeneron, Johnson & Johnson, and UCB. I also want to let you know that today's session will be recorded and available to view following the presentation. You also have the option to use closed captions. If you would like to, you can simply click on the CC box located at the bottom of the Zoom icon and select English as your language. You can submit your questions in the Q&A box located at the bottom of the Zoom menu, and we'll get to that during the Q&A segment. Now it's my pleasure to introduce today's wonderful speakers. We have Stephanie Marshall, who's the Director of Patient Advocacy at the Assistance Fund, and Jennifer Noonan, who's Vice President of Clinical Strategy and Patient Engagement at Accessia Health. They're going to take the time today to share how their organizations can help you with coverage of medications and related medical expenses. Stephanie and Jennifer, welcome, and I'll hand it over to you.
Okay, thanks, Jenna, for that kind introduction. And it's my pleasure to be here with the MG community and to share information about financial resources that are available to help with out-of-pocket medical expenses. And it's always good to be here with my friend and colleague, Jennifer Noonan. So it's just a pleasure. So I'll hand it over to you, Jennifer.
Thanks, Stephanie. Always nice to see you in the community. Often I run into you at different scientific advocacy meetings. So it's nice to be able to join together and give this community some information about both of our organizations at the same time so that they don't have to seek different directions to get to that. I know we just talked about right before this got started, the concerns that have been going on in the rare community and in particular in the MG community. So I'm going to pass the baton back to you and give you an opportunity to provide an overview for us about what it is that the Assistance Fund has for these folks in the community.
All right, thanks, Jen. And just to set the stage a little bit, at the Assistance Fund, or TAF, we go by our kind of short name from time to time. We survey our patients every year to really get a better understanding of those top challenges. And I'm going to share some recent findings from our most current survey about the top 3 challenges. They include affording my health care, finding a treatment that effectively manages my condition, and adjusting my lifestyle to accommodate my condition and medical needs. And also, for the first time, another finding emerged in the top 5, and that was patients also reported that delays in accessing medication through their health insurance negatively impacted their physical and/or mental health. And that was a notable finding to me because I am hearing anecdotally when I meet with patients at conferences that there's an increase in denials by insurance for certain medications or certain care protocols. So that, I think, is something we at TAF are thinking about, and I know the MGFA is also thinking about. So I'm sure those challenges resonate with you. And I think this unpredictability causes a lot of concern. So I'm going to share a little overview of the Assistance Fund and our financial assistance program for MG and just kind of how it works. So I'm going to pull up my slides, so bear with me for a moment here. It's always a little awkward.
And Stephanie, while you're doing that, just a quick question. Didn't I remember you saying that in that survey, it was discovered that over 50% of individuals surveyed were struggling with affording their health care?
Yes, it was 56%. I'm going to do this again. Thanks, Jen. Technology, it's wonderful, but then it gets a little clunky.
I can see your screen.
All right. Trying to get to the beginning. Here we go.
Looks great.
All right. All good, Jen?
Yep.
Okay.
On your, looks like the financial assistance program slide.
Perfect. Thank you. So the Assistance Fund, we launched an MG program in 2017, and it helps with two types of assistance. One, copay assistance for prescription drug use. So that can be copays, deductibles, and coinsurance on any FDA-approved treatment. We also provide financial assistance in two different ways. One, for the monthly health insurance premium. And then we also help with what we call medical incidentals. And that could include therapy administration costs, so those copays, disease management, so physician visit copays, treatment-related travel costs, so that's ground travel, hotel, tolls, mileage, and also diagnostic laboratory tests. So one important note about our financial assistance, we do not cap our assistance in the calendar year. So whatever the assistance is, whether it's for copay assistance or the two types of financial assistance, we do not cap that assistance in a calendar year. So in terms of eligibility, we try to keep it pretty simple. So you have to have a diagnosis of MG, be a US citizen or permanent resident, meet household income eligibility. And the formula we use is based on household size and annual income. And we're pretty generous in the ceiling of the income that we cap at. Also, to be eligible, you have to have a prescribed FDA-approved treatment. So we cannot provide copay assistance for off-label uses or drugs that are not approved or in clinical trial. And then the fifth requirement is you have to have a prescription drug coverage for that treatment in your health insurance plan. So that's also another important component. I just want to talk a moment about that. So you have to have insurance of any kind. So Medicare, Medicaid, commercial insurance, TRICARE, VA. If you are seeking assistance for the prescription copayment, that drug needs to be on your insurer's formulary, because we technically reimburse you for that out-of-pocket expense. So it has to be on the formulary. And we also have on our website an eligibility tool that walks you through these basic questions and can tell you immediately whether or not you would be eligible for one of our programs, including MG. We try to keep enrollment pretty simple. So we encourage people to use the online process. So you can visit taftcares.org and go to the MG page. And there's a button, Apply Now. We immediately tell you whether or not you're eligible. And if you are eligible, coverage starts immediately. You can also call one of our patient advocates at the number on the screen there, and they can also walk you through the application process. You can fax it in and you can do a printed copy, but we really encourage people to use the online process, and we keep that simple. And in this online enrollment process, we don't ask for any documentation. You just attest to the truthfulness of the information you're sharing. And occasionally, due to our compliance program, we will randomly audit applications and may ask for documentation at that time. But at the time of enrollment online, we do not require documentation. And we are a reimbursement-based financial assistance program. So you do pay the out-of-pocket, and then we reimburse you for that out-of-pocket expense. So you would submit documentation. We require two types: documentation that you received the prescription or you were at the physician visit, and then documentation that shows you paid that. And that could be a credit card statement, that could be a receipt. Once the documentation is received by us, we review it within 15 business days. We approve it, and then we make payment through either electronic payment or check, and that's your preferred method. You let us know that. In the instance of a prescription drug copayment reimbursement, the Assistance Fund works with specialty pharmacies. And we know that out-of-pocket copayment can be very, very, very high. So we work with the specialty pharmacies, and they can bill us directly for your copayment. So you never see that out-of-pocket expense. So that's a way we try to keep your out-of-pocket manageable. And so that's an overview of just our program, the eligibility, how you apply, and then the actual reimbursement process. And I think, Jen, you're going to take it from here.
I'm sure going to try. I'm going to hope that my my skills for navigating are also doing well for us today. All right, I'm going to share my screen and get this PowerPoint going here, I believe. Here we go. Just let me know if that looks okay.
Yep, got it.
All right. So you gave lots of great detail about very specifics on your program. I love that you did that. We have quite a few of those same processes that vary just a little bit, which is why I think it's so good to be able to have us here at the same time. It doesn't mean everyone's going to be able to keep it straight, but it is helpful to call out some of those subtle differences. So one of the things that we did at Accessia Health in the last few years, similar to what you were explaining there, Stephanie, is we have recognized that there's a need, shifting need in what the financial support has become kind of hinged upon. And we see that some of the things that have gone on recently, such as the Medicare cap on medications, has been helpful, but we've definitely seen a significant rise in premiums and the need for that. And so within our programs, we do help with some of those same services that you mentioned before, because we know that without your health insurance premiums, you might not be able to afford any of the rest of your health care. Let me see if I can get my navigator to change. Oh, it's got the, sorry, my lovely, there we go. So what are the different ways that we support patients in all of our disease programs, and specifically in our MG program, which we just opened this year? We help with the copay assistance, and similar to the assistance fund, we do that in a variety of ways, but the quickest way for that out-of-pocket cost to be just reflected away from you and not have to be something that you have to worry with at all is that in the same way we work directly with specialty pharmacies and can help just pay that direct out-of-pocket once they've adjudicated your claim. And we have a separate pharmacy benefit card for that. And then we have reimbursement, different ways of going about getting reimbursement for things such as those out-of-pocket costs for doctor's visits. So think about your co-payments for specialty visits or co-insurance if you have infusion costs or a medication that might be landing in the medical bucket, if you will. We also recognize that travel has become very expensive for everyone. And so again, in our programs, we do have an allowance for travel for all of our grants, and that's capped at $500 for the calendar year in each of those programs. Go ahead to this next screen, just real quick talk about one of our little small but hidden gems, I'll say. We have a team in Tampa office that do nothing but handle and help people navigate the denials for Social Security, disability. Often we know that individuals who start to struggle with being able-bodied also struggle with the support needed in order to get that moved through the system so that they can get help. So we are able to help with that. Even if we don't have the ability at that time to take a case on, they will absolutely help provide some free legal counsel about things that you could get together to help with that. Also, we have just a lot of educational series that are available on the website to help with different, components of the navigation of healthcare. And we do also have insurance case management specialists. So what they will do for people who are maybe changing roles, or they maybe are aging into Medicare, or maybe they've become eligible for Medicaid and things are changing in their financial outlook. They can help people navigate and understand some of the different options that are available for them based on their individualized needs at the time. And so for us, similarly, we have applications that we accept over the phone. We actually have a few folks that still send in paper applications. If that's a necessary item, we do make that available for those that might be in rural areas or don't have internet or connectivity. And we also do offer a portal, which is the quickest way to get through to our services. If that's an option, we always recommend doing it that way. Similarly to the assistance fund, we verify diagnosis. We do for about 98 or more, like 98 to 99% of our patients, we are able to verify income immediately and determine eligibility based on that. Once we receive that information, we're able to give a determination. And then just like the assistance fund, we do have some ongoing audits that we perform just to make sure that everyone is keeping up to the high standards of compliance. I think that was the last of those. I did want to real quick just switch over and put this up, and it'll be available afterwards, just specific to the MG program. We have the eligibility listed there. We do accept individuals on our programs who are not at that time prescribed or taking a medication treatment for MG. But again, we just do have to verify the medical diagnoses with the care provider. The household income for us is 500% the federal poverty limit. And we do also assist individuals who are uninsured if that happens to be the case. But our goal would be, of course, to help them find insurance and get insured. So I'm going to stop sharing here. And say, I think our how our programs work together would be kind of helpful for folks to understand. What do you think?
I think so, Jen, because you know, Accessia has their program, TAF has their program. Also, many of the manufacturers also have patient assistance programs. And I know both of us are often asked by people when we meet them at conferences, well, how do I decide which program to use? And there's really no right answer. You have to understand each program and what your needs are and kind of marry them up. And I often say to patients, Jen, that Accessia and TAF, we're all, and MGFA, we're pieces of a quilt.
Yeah.
And our healthcare system is very complex, and the patient often has to be the one to put the pieces of the quilt together. But maybe, Jen, you can elaborate on that a little bit of, how a patient can research the different programs and make some decisions.
Well, I think that there isn't, unfortunately, one size fits all. That would make this whole complex healthcare situation a little less complex right now. But I do feel like it's important for people to have all of the information. As you mentioned, health literacy starts there. So making sure, I think, that everybody in the MG community knows what all of the different resources are, connecting with some of those different local, to regions, groups as well. But also, like you said, looking into the manufacturers that might have programs that would fit their situation better or have a more lasting benefit throughout the year. Sometimes specialty pharmacies or hospital systems also have charitable assistance programs within them that don't have the same confines that some of ours might have. And so it's another suggestion that I recently heard and do pass along, that if you're embedded in a specialty pharmacy, you might just check in with them, or advocates check in to see, hey, do any of these specialty centers have resources that might help people? You never know, maybe they have something available for one healthcare expense they didn't realize they could ever get help with.
Right. And that's a good point, Jen. There are resources that are available often to help with utility bills, rent, mortgages. And it's never, it's always good to ask. And one should never feel reluctant about asking whether or not there are resources available to help. I think it's widely understood that treatments for MG and many other serious conditions are extremely expensive, and healthcare has gotten expensive. So, don't be shy about asking and exploring, and you might find a resource that doesn't work for you, but you know of someone else that it might help. So it's always good to ask.
And also, just because I've listened to you talk before, we've been nearby a lot at conferences. I've heard you say this as well. I'll let you elaborate, but on Accessia Health's website, if you navigate to a program in particular, MG, for this particular webinar, there is a separate section listed in the MG resources that has all of the financial support organizations. Because while right now it might be that we, Accessia Health and the Assistance Fund, are the two organizations out there in our charitable copay network, have funding, it could be tomorrow that another could open the doors with some funding. And so I think it's important that as people navigate this healthcare difficulty, they would, just know that there are other financial support organizations out there to make sure that people are getting all of that data.
Yeah, that's a good point, Jen. And you kind of touched on, for both of our organizations, we will indicate the status of a program, whether it's open, waitlisted, or closed. And if a program is noted as open, both organizations are accepting new applications. If it's waitlisted, for at least TAF, what this means is that for right now, we do not feel we have enough funding to take on any new patients. And that's really important to TAF because we don't cap our assistance in the calendar year. We have to manage those funds pretty carefully. When a program is closed, we're taking applications from the wait list. And when we do get additional funding, we go to that wait list and it's first come, first serve. Or a program might be closed because we really don't expect to receive any additional new funding and we just cannot take on new patients. But our MG program is currently open to new patients now. And maybe Jen, I'll let you add to that concept of open, waitlisted, and closed.
Yeah, that's really a great call out on the bit of a nuance and difference between us. We also carry a wait list, but the way that we have our status is also on the website. It'll show open, which means you can apply today. And as long as we get all of those requirements in, you can be accepted into the program right away. If you see the listing as at capacity, that for us means that right now, the funding that we have available is already allotted to the number of patients that we're able to serve. But that changes sometimes weekly, where we have additional donations come in, or we have individuals that have dropped off of our service because they no longer have a need, or they found a financial resource elsewhere that better suited their needs. And so those programs that say at capacity for us, they mean they're waitlisted, and we encourage you to join the wait list. One thing that we've heard, a common thought out there, is that if it says at capacity, that means I shouldn't apply. There's no money. There's really not going to be any help. But what no one sees at the front door when a wait list is involved is at capacity might mean one person in the waiting list. It could mean 100. I don't know those numbers because we don't have access to that kind of information. It's, again, part of our compliance. However, if there's only one person on the wait list and we have funding come through next week, you'll never see that green light if you aren't already in line. So I think I've heard you say the same thing. If you see a wait list, but you anticipate a need, we encourage you to go ahead and apply. Is that your way of thinking as well?
Yes, absolutely, Jen. Right. I tell people never be discouraged if you see wait list. Because, right, as Jen mentioned, program can open from week to week, and yeah, not to be discouraged. I guess I will add too, maybe, Jen, our programs, when you enroll for the year, at the end of each calendar year, we have re-enrollment for the next calendar year. So if you're a member of the program, you do need to re-enroll for next year. And it's a very simplified application process. And we try to keep that simple. But for those who might be on the call who are currently in the TAF program, you'll be getting information very soon, the dates of your re-enrollment. So our assistance is for a calendar year.
Yeah, that's, I think, where there has been some confusion. And I say, everything is always evolving in healthcare, but that never makes that change fun or easy. And we have been making some minor updates throughout the last couple of years, trying to improve our processes, and also to, I think, make sure that we are providing the most consistent way of doing things. We don't want to stand out from everybody because that would just make things a lot harder. But right now, the way our program works is if you enroll even in, say, September, October, going to be right around the corner, that assistance that you've applied for and that amount, the award, is for the calendar year, and so needs to be utilized as it's able to be by the end of the year. And if someone is in our program and we have adequate funding for the following year, at this moment, there's not an opt-in necessarily, but you would remain in the program as long as you continue to meet that eligibility. And so to your point, I would say to all folks that might already be on assistance of some sort with Accessia Health, this is the time when you would want to just keep a watchful eye on your communication, because for some folks, nothing has to happen. We have what we need on file and we run that eligibility quietly in the background and they never even know. But for some people, there's a question or some documentation that we need, and we only allow a certain period of time to get that back to us. So very good point to keep an eye, especially this time of year with insurance changing and open enrollment. There's a lot of communication. And so unfortunately, we're asking you to keep your eyes and ears peeled.
Yeah, yeah. And Jen, and I think, right, sometimes all of the information we share can feel overwhelming at first, and I think we might have some people on the call who are thinking, well, what should I do now? And I think I would say go to both of our websites, read a little bit more, consider your needs. And right, it's still September. And as Jen said, we both cover for the calendar year. If you do feel you could benefit from some assistance, go ahead and apply. Make a decision and apply. What would you add, Jen, to that?
I would add that based on this conference that was just seeing you at a few weeks ago, it was a crowd of folks, again, a new program that we had not had in quite some time. So I was speaking to kind of a newer group that wasn't familiar with Accessia. And so just suggesting that sometimes when you have a dollar tag that's so big, on that treatment itself, that's all you can really think about, it can be easy to get pigeonholed into thinking that the only thing we can do here is seek help finding a payment or a way for that one medicine. But sometimes it is those premiums that could make the difference. And so I just would urge people to keep that in the back of your mind as you are moving into this next year and thinking about how am I going to afford this really impactful health condition. Well, I can tell you, I'm sure it's going to be tough and challenging, but we both have at our organizations some different options that might help ease a little bit of that burden. And so don't just think about the one part, look at some of the other components and the things that matter too, like wellness, you know.
That's a good point. And right in Accessia, the legal support is really helpful because that's also another tough area to navigate. And again, at the conference where I just saw Jen a few weeks ago, I met a number of people who were newly diagnosed and were able to access their treatment through a manufacturer's program, but they were looking at really high health insurance premiums. And that's where I said, well, TAF can help with the health insurance premium. And I think we're all a little concerned that health insurance costs may increase next year and in the years following. So you can, in some instances, obtain assistance from two different organizations. What you can't do is double dip. So you could not receive premium assistance from Accessia and premium assistance from TAF or copay assistance, but you can kind of put some pieces of the puzzle together.
That was a great question, actually, Stephanie. I'm glad that you brought that up because, as you know, we have the exact same message at Accessia Health. But another question I think that I tend to get asked, and it just went right out of my brain. Oh my gosh, what was it? Oh, you were talking about
Health insurance and
sure it'll
double
come back.
dipping. And
No, it wasn't necessarily. Oh, I know. I was going to ask you about rules at the assistance fund because at Accessia Health, we have been asked if we would cover someone in multiple programs. And so when we think about our traditional programs, our disease-based programs, because we do have a couple of other emergency type funds that have been around here and there, and that's not really what we're talking about. We don't allow someone to be in two programs at one time. And so some examples of that might be a primary immune deficiency program, and then some very specific primary immunes that might have their own program. Like you couldn't be in simultaneous programs. But we have stated that if someone is in a program, say they have a disease like, I don't know, we'll just say asthma, and they also have, some other completely unrelated, maybe not all that unrelated, but an autoimmune disease. If they ran out of their funding in one program, we do allow individuals to apply into another if they happen. That doesn't happen very often, but we have been asked. So do you all have any kind of?
it's also a little nuanced.
Yeah.
If someone has two conditions that are unrelated and need copay assistance, they could be part of both programs. But you could not obtain health insurance premium support from both programs.
Sure, that would be the same as us sharing, I guess, or double dipping kind of, wouldn't it?
That double dipping.
Mm-hmm.
I had mentioned earlier about manufacturer patient assistance programs. So many manufacturers have programs. One very important distinction between the programs they offer and the programs that TAF and Accessia and other charitable organizations offer, the manufacturers cannot provide financial assistance to those who are on Medicare or Medicaid, so considered public insurance, where Accessia and TAF can help people with any type of insurance. So that's an important differentiator between the charitable patient assistance organizations and then the manufacturers.
It's a great call out.
Yeah. And I'm thinking we probably have some questions in the Q&A.
I
And
noticed
I
that.
think Jenna's going to help moderate the Q&A. Can I toss it to you?
Yeah, absolutely. Thank you so much. And you guys actually were answering a couple of the questions that came up about that double dipping. There were quite a few about that, so that's great. You were able to clarify. Another question that we have is about if either fund will cover expenses for MG related things that aren't the drug itself, such as copays and insurance, but if the drug is off label.
So I guess the only answer I could give without knowing a lot of more details is this. When we are going through our process of determining eligibility, we don't lead with a medication. So we don't ask people what medicine that they actually take. Now, our PBM, of course, finds that out if there is a claim that would come through, but expenses outside of the actual drug treatment itself related to MG, we help with. We cannot, for compliance reasons, pay for or help cover an off-label use for a drug. But, any kind of visits, if it's a specialist visit that we would normally allow in that program, that would still be allowed. I think if the question gets much more specific than that, then maybe we should talk offline. But do you have a different answer for the assistance fund?
Because we do ask about the FDA-approved treatment and whether or not it's on the insurance formulary. One answer would be no, we would not provide financial assistance. However, there are the nuances, and I think like Jen, and that's a tricky thing. I think both Jen and I acknowledge there are nuances and subtleties to the financial assistance programs that sometimes need to be delved into further.
Yeah. Sorry, it was kind of a tough question, but I'm glad that it got asked because that's what always makes me think about the next time and making sure.
Right. And related to that, sometimes we are asked, will we help with participation in a clinical trial? And that answer is no, unfortunately not.
Okay, thank you. That's really helpful. This other comment is, I recently lost my Medicaid and I need some assistance around the house. Do either of these programs provide home care assistance?
We do not, unfortunately.
Yeah, we have on occasion assisted with actual nursing as it related to like a a very sick, child. And at one time there was an elderly person, but it was nursing, like ventilator support. It was actual direct medical provisions of care. So for anything outside of that, as much as I fully recognize the burden that a house can be on a completely able-bodied, well person, I wish, but we don't have any kind of ability to cover those types of things. Again, it sounds a little bit odd, but I know that Stephanie will echo my sentiment here. I'm a nurse by trade and worked for 25 years in environments where we had very clear rules, very black and white guidelines about what we did and didn't do. And in this industry, there are some nuances around the compliance that are just different. And they're hard for most people to understand, because why would you need to even understand that? It took me a long time to kind of see through that. But at the end of the day, we are limited to what we can and cannot cover by those compliance guidelines that we have. And each of us as independent charitable assistance organizations, we have our own actual guidance that's different. So that's, I think, just sometimes helpful for me to understand the why. Like, why does TAF do it a little bit different than PAN or Good Day? You know, we all do it based on what our legal compliance tells us. And so we know that there are a lot of other things that people need help with. And that's why we're hoping we can connect those resources with the whole MG community by way of having different places that are embedded for everyone to be able to go seek resources for those things, like rebuilding a ramp or building a ramp to your home so that you can actually leave it if you have a wheelchair and that's what you're bound to. Sorry, that was a lot of words.
I think that's really helpful. And I think having the opportunity to learn a little bit more about the reasoning behind the programs is helpful too. And it's very beneficial as people go through the application process. One of the other things that I wanted to ask that's been popping up quite a bit is about what are some tips and tricks for going through the application process? How much time should people allot to sitting down and doing that? Are there specific things that they should have on hand before they sit down to do that paperwork? Can they save and come back again, or do they have to sit down and do it all in one fell swoop?
That's a good question. That's a really good question. Our application process, the online, it's very simple. It walks you through the questions related to eligibility. So probably the one piece when it asks about income, it'll ask what your annual income is. And that annual income is just straight up income that comes in. So that could be what you're paid by an employer. That could be your Social Security payment for the month. Income does not include assets, does not include brokerage account amounts, what's in an IRA, or the value of your house. So when you sit down, just kind of knowing your monthly income, what that amount would be. In our process, you can start it and save and come back. So you can do that, but we try to keep it really pretty simple. I think having on hand the names of the medications you take, your provider's information would be handy. I do tell patients, because we're reimbursement based and the documentation's required, to keep pretty good records. And I will share that, you know, our process can be a little clunky. We're working to improve that and make it more streamlined and patient-centric, but having good documentation is also very helpful for when you're in the program and seeking reimbursement.
Yeah,
And
I want to make sure you were finished first, though.
yeah,
Yeah,
go
that's
ahead.
all pretty much. I mean, yes. So our process is also sometimes a little bit clunky from a paperwork, so to speak, standpoint, but actually testing newer versions of our patient portal every day. We've just talked about it this morning. And so we're, you know, trying to make that a lot faster, but you can just sit down and get online and with, like you asked, and what a great question, the right information on hand. It's just like 4 pages. We also have at the very beginning a pre-qualification screen is what it's called. It's also kind of the beginning of what I tell people for the moment we'll refer to as the like provider applicant or guest applicant. So you can apply on behalf of your patient if you're a provider's office or a caregiver to someone. The pieces that I think are most important is understanding having your provider's information is good, because there's a place where that comes, where you need to, you know, put that information in. You don't have to put that information in. I don't think it's a hard stop, but it sure connects us super quickly with the ability to expedite that medical care statement. So having that on hand, Social Security card and or visa or work ID information. If you don't have a social for application is important to have. Again, with the income, same thing, that Stephanie said, a very good point. That's hard because we all have applied for different things here and there in our life. And some people want adjusted gross and some people want net. And if you're not a financial person, you might not know what that means. So just what you bring home is perfectly put, especially for those people who are starting to or thinking about or just did retire. There is something to consider. Tips and tricks. This is something I would have never thought about prior to the last couple years. But if you are commercially, meaning you don't have Medicaid, Medicare, TRICARE, VA, none of that, and you're aging into Medicare, or you might be moving to some sort of public insurance, and you are in this really expensive world, take some time to navigate that. Find people to help you, get information if you can, because this very conversation that Stephanie brought up is why I learned about it. You've had a small business throughout your life. You've made a living, but clearly not nearly enough because you've also been sick with this diagnosis that's taken a lot of your income. And now you want to retire. How much do you pay yourself? It's an important question to think about, because if you could navigate to some sort of charitable assistance or even a manufacturer program that has a limit or a ceiling on how much you can make, $100 difference in what you bring home in a year could mean $10,000 difference in what you pay out in a year, if you think about it. And that's not how we want to have to navigate forever in life. But if you are, navigating this, then it might be worth your time to really put some time into thinking about that. I will if I ever have to. I mean, it's just, I would have never thought about that.
Thank you both. That's really helpful. There's another question that pops up quite a bit, which is around if I have to travel out of state to see my specialist, do you ever help pay for fuel or a hotel or other travel expenses related to that?
Yes, we do at TAF, yes. So we would cover not fuel, but cents on the mile. So what the mileage is. And there's an IRS formula, I think it's like 60 cents to the dollar to the mile, something like that. But we also cover air travel. So if you actually need to fly, we would cover a maximum of $400 for air, hotel 2 nights, meals, $95 a day, cap. So yes, so for travel, because we recognize many people do travel out of state to a center of excellence, or if they live in a rural or smaller community, may travel. So yes. And travel can up, as Jen mentioned, travel has become very expensive.
Yes. And I think we have been asked before, like, why the cutoff at $500, right? Well, again, we have this opinion that we operate under from a compliance standpoint, and the suggestion was that it needed to be considered a reasonable amount, and that somehow is where we landed with the legal team. But we cover ground transportation, so that's the one thing we don't cover is air travel. But we will cover ground transportation, hotel, gas, either reimbursement, or we can use direct pay with a card, that money is loaded on. But yes, we also recognize that people have to travel really just across town sometimes can be really expensive. So we have travel built into ours as well.
Wonderful, thank you. It's very helpful to hear kind of the differences with each program and the offerings around that. There's a couple of, they're a little more nuanced questions, but I think that they could apply on a broader scale. So one question is, my daughter receives SSI as she has cerebral palsy. Does her assistance count toward the household income? Her money is mostly spent for health insurance, so there's not other money left aside each month.
I would say no.
I mean, I would say no, because when you when you file your taxes, you're not going to be utilizing that income you're not going to report that back to the government because they're giving you that. I mean, maybe you will from a line item standpoint, but that is not typically what I understand as being included, no. So that would not count as income, no.
Great, thank you. And then this is another one that is a little nuanced as well. If a medication is a primary treatment for another condition, but it is also considered off-label for MG, could this be covered? Would you need to sign up for assistance for a separate program that's not related to MG to get support for it?
That is a nuance. If the drug is being used for MG and it's off-label, the answer would be no. But on our website, taftcares.org, on the MG page, we do list the covered treatments, and there are about 20 of them. So, and I should have mentioned that earlier in my presentation. It's easy to check the treatments on our website, because if you're on a treatment that's not included on that list, we would not be able to provide copay assistance.
I'm going to throw one little nuance of my own into this. We do not typically cover we don't cover off-label use. However, in the world of immune globulin, there are a lot of brand names across the spectrum, but at the end of the day, they're all immune globulin. And so while we do not just auto cover someone who is on an alternative brand, if IVIG is considered the FDA approved treatment for MG, then a variation of IVIG could be, with a clinical correlation with our clinical team, we could consider covering the out-of-pocket on that, because technically it's not off-label, but it would depend on insurance. So that, I think, whoever asked that question, if they really have a situation like that going on, Jenna, will you just connect us after? Just give them my email or something?
Yes, yeah, happy
We don't
to.
have to do that very often, but it's come up a time or two where there was, there were shortages, or there was, in the CIDP community, individual who just didn't do well with one kind and tried several others and had a product that was effective, but nobody wanted to pay for it because it was called something a little bit different, but it was still IVIG at the end of the day.
And that sounds like a good example of needing to advocate for oneself and really take the time to go through and have the conversations. It sounds like with both programs, there's that opportunity to ask clarification questions when you need them, and to understand that there's guidelines in place, but at times some of these things are really nuanced, so it doesn't hurt to ask.
And I had no idea, Stephanie, that you all could help someone fly to a center of excellence. So that's great to know. Sometimes that's what's keeping people from seeing a specialist altogether, is having to cross several states, That's good. Yeah. Good info to have.
We have another question that's about eligibility for kids over 18 who are disabled and needing help with SSDI application or care. Would they be eligible for either of these programs?
I mean, so they would have to have a disease for us. Now anybody can call and get help from our Access program, the legal program I was telling you about. And so again, at the end of this, you can send that card out and it has their phone number. But they could also help an adult or a child in that program. But for any person, no matter what age, to be in one of these traditional programs that helps with copay like MG, they would have to have the diagnosis of MG.
Wonderful, thank you.
I feel like I might have missed part of it. Did I cover the question or?
Yeah, I think it's about being able to utilize that
The Access program.
The Access
Yeah.
program.
Mm-hmm.
Yeah.
Yep.
So that's great to know. Well, that concludes the question portion of today. I wanted to thank you both, Jennifer and Stephanie, for taking the time to talk to us about these really important programs and the potential that the MG community has to leverage them. Thank you so much.
Yeah, it was great to be
Thank
here.
you, Jennifer. Thank you. Yeah, great to be here.
Thanks.
And thank you everyone for joining us today. We hope to see you on future webinars. And if you need additional information about these programs, they're both posted on the MGFA resource page, which is included in the chat. And you can feel free to go there to get direct access to both websites. Thank you and have a great day.
Thank you.